we're here at the Foot Health Center in Jackson, Michigan. I'm about to go in and interview Dr. Beekman, who's an orthopedic surgeon. If you guys have ever wondered what being an orthopedic surgeon is like or ever had an interest in becoming one, come follow me. So I've just had a few minutes to talk with Dr. Beekman, and so now I'm going to ask him some of questions for you. Where did you attend high school?
I went to high school in Openness, right outside Lansing, and then went to Michigan for undergrad medical school. And after that, I did my residency at Wayne State in Detroit, and then did a fellowship in hand surgery in New York at Columbia.
So what interested you about becoming an orthopedic surgeon?
I always loved things mechanical. I went into undergrad thinking I would work on cars because I love cars, but I finally decided I did not want a graduate degree in that. And so I'm like, well, why don't we just go into medicine? And I always loved things mechanical, and medicine and anatomy certainly are. And then once I got into medicine, orthopedics just seemed like a great fit, and I love to use my hands. And hopefully all the woodwork my dad taught me when I was a kid helps me to be a little bit better at things.
How did you decide on working on hands?
I love the intricacy of hands. My chairman at Wayne State put it as general orthopedic surgeons tend to be carpenters, but most hand surgeons are more of a watchmaker. So it's more intricate, and I like the challenge of that.
What's the most exciting thing about being an orthopedic surgeon?
There isn't anything exciting about being an orthopedic surgeon. Where I trained in Detroit, so orthopedic training is usually 5 years after medical school. Some people will do a year of research at certain programs, but in general it's 5 years. Where I trained in Detroit, we got a lot of trauma, meaning a lot of car accidents. We also got a lot of gunshots and things like that. And I still recall I took a night of call when I was a medical student in Detroit. And I still remember I walked out of there the next day saying, I can never come here. And of course, that's where I trained for 5 years. So it's a great feeling when you can take somebody who's just been in a car accident, and their leg's shattered, and you can pull on it and get them in a splint and take them to the OR and fix it. And, it's not always like that, but that was a fun part of it. I love my job. The great thing about it is that the time is an unknown. So I may come to work and have 5 hours of work to do, and I go home because I get the work done. And that's true with surgeries. But then I'll be here, and somebody will come in because they put their hand in a table saw, and that may mean I'm going to be here another 5 hours after that. So the unknown, meaning I could be here for 5 hours, I could be here for 12, is both good and bad. I don't like. A lot of people go into emergency room medicine and they're here for a defined period of time. I would rather be here until the work's done. And sometimes it takes 24 hours, and that's fine. And I like that and dislike it at the same time.
What keeps you motivated in your job?
Always learning. I think that if you stop learning, you're probably going to stop being any good. Hand surgery has not changed all that much over the last 50 years, surprisingly, but we're always coming up with new information on how to treat patients and how to improve their care. And you can go to medical school and you can do a residency, you'll never see everything you need to see. And every day I have patients I have no idea what to do with, and I figure it out. And the problem solving, it's just constant and exciting.
What do you enjoy doing in your free time?
Right now, I get lead poisoning because I'm working on an old house with my family. My dad and I are doing that together, so that's fun. Oh, I love working on old houses. So, old cars, old houses. I actually do spend some time with my family. I have a new 4-month-old boy and a 3-year-old girl who's fantastic, and I even like spending time with my dogs.
Do you have any advice to offer students interested in going into the medical field?
I would say the one thing I did not do was get more information. I kind of lucked out at every level in terms of making, I think, the right choice for me. But I think it doesn't hurt to, if you think you have an interest in a field of medicine, to go out and just ask a doctor or a nurse that you know to tag along with them for a day, and make that time commitment just to go do what they do. I always thought I would go into emergency medicine. I did it, and I'm like, well, I just looked at the clock. And so I got lucky, but I think more information is good, more experience you have, the better. And just jump in and get your hands dirty. And a lot of people, we used to have high school students in Detroit, we would let do all kinds of stuff. And we'd watch them and make sure they were doing it properly, but you know, it's, you learn by doing. So.
What has been the most rewarding surgery that you've done so far?
I would say that my most common surgery that I do is carpal tunnel surgery, where we release tight bands over a nerve at the wrist to relieve pressure on that nerve. And I would say in general it's probably one of the easier surgeries, but it also carries a lot of weight in terms of improvement for patients. And I would say they're my most satisfied patients, and for that reason it's probably my most satisfying procedure.
Are you ever afraid of making mistakes, or have you made any mistakes?
I have. We all do. I mean, physicians are not infallible by any means. I think it's just important, especially today, to admit your mistakes and say, look, we screwed up, we'll fix the problem. And to explain up front that the human body is a big unknown in a lot of regards. People act differently, their bodies act differently. And you can't, there's no way physicians can predict in every instance what's going to happen. And as a society, we just need to realize that. But if you make a mistake, just fess up and be honest, and that's the safest way to approach it.
What type of music do you listen to?
Probably my favorite band right now is like the Foo Fighters. But I listen to pretty much anything. I have a couple good friends in medical school that introduced me to a lot of different music. Something called the alternative, like Wilco, and some other bands. Foo Fighters. I used to be a huge U2 fan, but they've kind of killed it for me. Foo Fighters. I took my wife to see the Foo Fighters. She didn't like the mosh pit, but that was fun.
Alright, so I just left Dr. Beekman's office. I learned a bunch about being an orthopedic surgeon, and I'll see you next time.